everyone, Dr. Foster here today, and I wanted to do a show and tell. I always loved show and tell as a kid when I was in school. Very visual learner and feely, touchy type of learner as well, hands-on. So I thought it would be fun to do a show and tell today of all the different Chinese medicine modalities that we can use in a treatment. May not be all of them, but at least some of them that I have today. And then I'll do an expanded version later, really diving into what each one of them can do on a deeper level. But today I'm going to just have some fun, do some show and tell, and really just so you can get a good understanding of an acupuncture treatment. So with acupuncture, let's start with the needles. So the needles come in various sizes. They're fine, sterilized, one-time use. They used to be autoclaved back in the day, but now they're one-time use, thankfully, and disposable. And they're hair fine. So they're like really, really thin needles. They're the best needles you could ever have in your body. And they really I don't do a lot of deep needling. People ask, well, how deep do you go? It really depends on where we're treating, and then also the thickness of the skin. So you might have somebody who's heavier. You've got to go through a bit more fat tissue to get into the muscle layers. So you would use a longer needle. Also, if you're wanting to sedate a condition, you might use a little thicker of a needle, as opposed to if you were wanting to nourish and tonify, then you might use a smaller needle. But for pain, we're always wanting to sedate the pain. And then there are little tiny needles that are about half this size. They're called ear needles, and those could be placed all along the ear. I have an ear actually right here, my favorite ear. The ear actually represents a map of the body. So I love this ear. It's a lot of fun. I use it in a lot of my talks. But it represents a map of the body. There's points from your head to your toe. The internal organs will lie in here. I'll do a video down the road on auricular acupuncture, which is ear acupuncture. But we use little tiny needles. And then since I do have the ear here, I'll show you the ear seeds. So we can also place ear seeds on certain acupuncture points, and these are great for stimulating the points when a patient has left and you want to keep the treatment going. You want to be able to keep those points stimulated, or if the patient's needing to stimulate the area, then they can just go ahead. I'll put one on the ear here. This is a calming point right here. They can stimulate this little pellet here with a little circular massage, or just a tap or press and hold, and stimulate that point. They can also be placed all along the body on all the various different acupuncture points depending on what we're focusing on. And they can stay on up to a week or so. When they start to look grimy, you would take one, peel them off and throw them away and replace them with a fresh one. But I use these a lot on my weight loss patients for decreasing hunger. So if they're feeling hungry, they can stimulate a point for the hunger. And then a lot of that will come with the emotions that come with overeating or addictions. And then this would be a calming point that they could stimulate. So I love using ear seeds because this is a takeaway treatment that the patient can wear home. They can sleep in them. They can easily peel them off and remove them if they've had enough of the treatment, or even if it's bothering them. So these are ear seeds, and they're little tiny band-aids. With these particular ones have a little dark pellet, which is an herb, which invigorates the blood. If you see that little black pellet right there. There's also gold pellets, which would tonify, and then silver would sedate the condition. So you might want to use like a silver over a painful area to stimulate those areas along the body or the ear. So moving on, I do a lot of musculoskeletal treatments, a lot of pain. A lot of pain is due to tight contracted muscles too, especially like I said with the computer age now. We've got a lot of poor posturing going on. Ergonomics are not good, and body mechanics really need to be improved. So I like to use electrical stimulation on the needles. Now, some of you may have seen this before with physical therapy or chiropractic. They will use this transcutaneous electrical stimulation, also known as the TENS unit. I call it E-stim for short, or electrical stimulation, has various names. For acupuncturists, we can use these right onto the needles. So instead of using pads, which would be a more superficial treatment over the muscle area, we can actually attach the electrical stimulation. My wires are tangled as usual. But these can actually be clipped right onto the acupuncture needle. So this is going into the muscle layers, and then I'm attaching it to the E-stim, and it's going now at a deeper level to stimulate that muscle. It's actually working the muscle out. So the goal is to contract and relax, contract, relax, until that tight contracted muscle goes into a relaxed phase, and then hopefully stays there so it's no longer contracted and creating tightness and spasm and pain for the patient. So this is a really great treatment. I love using electrical stimulation on a lot of my musculoskeletal patients. Now, some patients get great results without it, or they may not like it. Whatever the case, so if you are using electrical stimulation, you really want to be a comfortable tapping. I always say more is not better with this treatment. Just a nice, comfortable tapping, because if a patient has a lot of inflammation, it can create more inflammation if it's too high and it's creating pain during the treatment session. So everything I do when I treat a patient, I want them to be comfortable, relaxed, really creating that foundation of calm and relaxation to set the stage for success. So this is the electrical stimulation, which is really great in the acupuncture session. Now, while that is all cooking on the patient, and down the road I'm going to do some videos live with some patients doing various treatments. So we'll probably do some neck and shoulder, low back, a lot of what I get, and other various treatments. But let's just say the electrical stimulation, the acupuncture is going with the patient now. I'm going to then use what we call moxibustion therapy. This is also known as mugwort. Artemisia vulgaris is the Latin name. And this is a warming herb which helps to regulate the movement of qi in blood. Very balancing for the body, and also dispels cold in the joints. A lot of conditions are due to cold getting trapped into the muscle layers, into the joint spaces, and cold does not help movement. So we really want to have a nice warm area to create movement and blood flow and to create healing. Now this herb is an indirect, this form actually is an indirect heating method over the area. So I wouldn't be doing it on an ear, but if I had a body, this would be your body. I would be doing it over your low back, your neck and shoulders. I do this treatment on a lot of my pain patients. And it's a very, very calming and relaxing treatment. It feels just like a dispersion of heat. And it's going right over the acupuncture points where the needles are and really going deeply within the body there. And this herb can also be taken internally, not in this method here, but the herb Aye is so beneficial for women's health, nausea. This can be a treatment for nausea, any digestive complaints, women's health, etc. So moxa is one of my best friends. I get this treatment for my own neck and shoulder treatment, and I love it because I'm always running cold, and I sometimes get pain. So since I get regular treatments, I don't have a lot of pain. I used to have chronic neck and shoulder pain, but since I have a preventative health plan set up now, I get great relief, and my body feels good most of the time. So after I do the moxa treatment, I'm pulling the needles. Oh, and I did want to just share, I use the infrared heat lamp. So I'm going to bring my camera over just so you can get a quick glimpse of the infrared heat lamp. Infrared heat is so great. Maybe, there you go. There's the infrared heat lamp. For dispelling cold, also for skin conditions such as dermatitis, eczema, any type of skin conditions. The infrared heat is so wonderful for pain conditions. It's great for back pain, neck pain, any types of pain, knee pain, you name it. Infrared heat is great. So I'll usually have the heat lamp over the area when I'm treating the patient with the acupuncture needles in. Now moving on, we're going to pull the needles. I love using moist hot packs, especially for the musculoskeletal pain patients. So I'll put the moist hot packs on the area, maybe about 5 minutes or less, and then come back and I use essential oil protocols for whatever ails them. Now, since I'm treating emotional conditions, I usually have the essential oils diffusing specific for their condition in the treatment room. I'm also using the essential oils topically, and also they can ingest certain oils, but that would need to be guided by a professional. And it would have to be a particular brand of oils that are able to be ingested, such as certified pure therapeutic oils. I use the doTERRA oils, and I can easily guide you. But I like to use a lot of essential oils for pain, and really from everything from A to Z. And I will rub the essential oil blend on after I've hot packed them. So you can probably guess by now the patient's floating on cloud 9. They've got the endorphins flowing, and they really all just want to spend the night. I told them we should open up a nap clinic. So I hope that you found this fun today to hear about and see my show and tell, and give you a better understanding of what we do in an acupuncture Chinese medicine treatment. And if you like this video, please give it a thumbs up. Please subscribe to my YouTube channel. Push the bell icon if you want to be notified of my up and coming videos. I am putting videos out weekly, usually on Fridays and Saturdays, or Saturdays, I should say. And any comments, topics you'd like to hear about, please give me those ideas, because I would love to put those into my list of topics that I'm going to be sharing. And I wish you a successful, healthy, happy journey to healing. And I'm here for you, so please reach out and message me. Until we meet again, be well.